The most common procedures known to people today when it comes to correcting their vision are the following: glasses, contact lenses, and surgical correction. But now there is another option, and here to tell us more is Jagrut Alalu. Hi Jagrut, how are you?
Good, thank you.
Excellent. So Jagrut, tell me a bit about yourself.
So I work for a practice in Hamilton called Visique Rose Optometrists. The practice was established in 1969 by a man named Paul Rose, and he invented a contact lens that's used in the treatment of an eye disease called keratoconus. I started working there in 2009, and I have a good fortune of working with a few contact lens practitioners, with Peter Walker, Pooja Radrali and Simon Rose. And what we've started is an orthokeratology clinic. Basically, it's a procedure which you sleep in a contact lens at night, you wake up, you take them out, and then you can see 20/20. It's just a whole new alternative to what the current options are.
So what are the most common types of vision problems that require glasses or contact lenses to be worn?
Sure, so there are three main ones: long-sightedness, short-sightedness and astigmatism. Now, short-sightedness is when you can see things clearly without glasses or contact lenses close up, but things in the distance are blurry. Long-sightedness mostly affects people over the age of 40, and that's when things far away are clear, but things close up are a bit blurry.
Yeah.
Astigmatism is a type of short-sightedness, really, because what happens is your eye is shaped maybe a little bit more like a rugby ball as compared with a soccer ball, and so we just need a rugby ball shaped lens to correct that and make the image clear for you.
So Jago, earlier you were referring to something called myopia control. Can you elaborate a little bit more for me? Yeah,
sure. So in May of 2010, we actually got some new worldwide research come out to show that for the first time we've got some proof that this procedure, as well as a couple of others with glasses and soft contact lenses, can actually help slow down the progression of someone's short-sightedness. So what I mean by that is, say we had a crystal ball and we knew that your 3-year-old was going to be -10 by the time that they are 9 or 10 years of age.
Yeah.
Say we know that at the moment they're -1. So there's a difference of 9 units of power there. What we can say with this procedure, just from the research, is that we can reduce the total amount that they will be by up to about 50%. So with the numbers I was saying to you, -1 to -10, I'm saying that we can probably keep them to at about a -5 or a -6, which is great. It means that we're stopping having higher prescriptions. Higher prescriptions equals more bad consequences and outcomes in terms of things like retina detachments and all these kind of sort of nasty things. So overall, it may even change our role as optometrists and what we do with people that are short-sighted. So, you know, we may come to a point where instead of just changing someone's glasses and contact lenses, we're going, oh, let's actually do a myopia control therapy to slow it down and stop them from getting worse, which I'm sure you agree is absolutely fantastic if we can help people.
Can't disagree there. Who can use this treatment? So you've got the 3 types of different...
Yep, so we've got the 3 different types of, let's call them ailments to your vision.
Okay.
Pretty much now with this procedure, there are a few practitioners in the country which we can almost do most prescriptions. So it's really a wide, varied procedure that's open for everyone.
So, and what's the difference between Ortho-K and, say, the other treatments that are available?
Sure. So spectacles are a great option for anyone. Some people don't love spectacles, so they prefer to have something else like contact lenses, where they're just not wearing spectacles much. Contact lenses are great. They're available in a daily and a monthly option. Yeah. And then there's also surgical options, which are usually for those people that have had no change in their glasses prescription or contact lenses for about a good 2 or 3 years. Most of my patients that have had laser surgery are over the age of about 25. So where Ortho-K fits is just an alternate and new option. It's completely reversible, so it just gives you the same sort of freedom as laser because you're not wearing anything during the day.
Yeah.
You're sleeping in it at night, and it's just another new alternative that we can use.
Is it uncomfortable? I mean, sleeping with something in your eye at night doesn't seem ideal.
A lot of people think that. However, it's actually extremely comfortable. A lot of the awareness of any sort of contact lens is basically from the eye blinking. As you can tell, most people when they sleep have their eyes closed.
Yeah.
So there's no discomfort at all. That's basically the whole idea of the procedure. And like I said, it's completely reversible. So you get a good amount of vision after the first night of wearing them.
So you say that the treatment is reversible, but is it a lifelong treatment?
Exactly. So it costs around about 1/3 the price of lasers. So some of my patients, I say, look, hey, if you're thinking about getting laser or want to get it, but perhaps it's just a bit out of reach at the moment, this may be a great option for you. Like I said, it is reversible, but one of the great things about it is that you'd wear them every night for the first month, and then we look at taking days away. So you may only wear them Mondays, Wednesdays and Fridays, and every other day you just wear nothing. So yeah.
Excellent. So how does a person find out more about orthokeratology, or it's short for short Orthocare?
Yep. So there are a few different websites. I happen to be on a board for Oceania as the New Zealand representative there, so you can always go to that website, and that's osa.net.au.
Yeah.
You can go to my website, which is orthokemi.co.nz, and if you'd like me to advise you on someone that's local for you, you can give me a call on 0800 Orthok.
Excellent. Thank you so much, Agro. It was really good to learn about something different, and hopefully something I might be able to try if I do lose my eyesight.
Great. Thanks for having me.
You're welcome.